More COVID mandates are gone as of today. Provincial guidelines for mandatory vaccination and testing have been lifted for workers in hospitals and schools, for example, although employers can still make their own rules. It is the next step before masks are no longer required in most places in 1 week. So, is the majority of Ontario ready for this? And is Doug Ford taking a political risk before the election?
If you want to keep your mask on, keep it on. If you want to take it off, take it off.
That is the big takeaway message from the Ford government. A week from today, when children go back to school after March break, people will be able to make their own choice. But there is a political risk it could backfire if cases go up. Even the Chief Medical Officer of Health has said the pandemic is not over.
Removing the mask mandate does not mean the risk is gone.
But that warning has largely been overshadowed by the mask debate and the message Ontario must learn to live with COVID. Veteran pollster John Wright has been assessing the public's mood.
The numbers are very clear. Ontarians are the most cautious in moving forward of all of the provinces in this country. And in fact, from the political numbers, there may be an extreme group that just says, we want it all done and we want our freedoms. But the reality is that close to 70% of the people in this province want some vigilance. The issue that the campaign team and the Premier are faced with is the risk of vulnerability among the Ontario public that this is moving too quickly and that they are not at the helm being vigilant.
2 weeks ago, the Chief Medical Officer of Health said he believed the new version of Omicron, BA2, which is even more contagious, will be the dominant strain by mid-March. Epidemiologist Colin Furness says he can't predict its impact because there isn't enough data now that there's no widespread PCR testing.
We have put our heads in the sand. We're driving up to a blind corner really quickly. And normally when you get to a blind corner, you slow down. We've decided to speed up.
Furness also says no one can say for sure how many people have already been exposed to Omicron and have a natural immunity. If it's high, there will be fewer hospitalizations.
We know we can't wear masks forever, but to take them off in the middle of new subvariants as a sixth wave is beginning in Europe and elsewhere, in the middle of cold and flu season, it just doesn't make sense.
Furness says he's most concerned for unvaccinated children. He would have liked the government to wait until April at the end of cold and flu season before making a decision on masks.